Welcome to NeuroCurio. In this series, we explore everyday topics through the lens of neurology. I am Fable, and I establish the subject.
I am Vera, and I report the object.
Today, we will be talking about neurological conditions associated with freshwater exposure. Freshwater exposure, often considered harmless, can provide a gateway for free-living amoebae to enter the nervous system and cause rapidly fatal infections. Higher prevalence is seen in warm climate regions, such as in southern United States, Australia, India, and Pakistan, especially in areas where water treatment and maintenance is poor.
First, primary amoebic meningoencephalitis, PAM, due to Naegleria fowleri, also known as brain-eating amoeba. PAM is a rapidly progressive meningoencephalitis that occurs after contaminated water enters the nasal passages, traversing the cribriform plate and invading the brain parenchyma and meninges. Clinical features include fever, headache, vomiting, meningeal signs, altered mental status, and seizures, typically developing within 2 to 14 days of exposure. Early aggressive anti-amoebic therapy with intravenous and intrathecal amphotericin B is the cornerstone of treatment, combined with a cocktail of azithromycin, rifampin, fluconazole, dexamethasone, and miltefosine. Adjunctive measures include management of cerebral edema and supportive neurocritical care. Survival is rare. Second, granulomatous amoebic encephalitis, GAE, caused by Acanthamoeba species and Balamuthia mandrillaris. GAE results from hematogenous dissemination of trophozoites from a primary site, often skin or respiratory tract, to the central nervous system, where they invade the brain parenchyma. Patients present with subacute to chronic headache, focal neurological deficits, seizures, and altered mental status. The disease course is slower than PAM, with incubation periods of weeks to months. Combination antimicrobial therapy is recommended, typically including pentamidine, fluconazole, sulfadiazine, flucytosine, azithromycin, and clarithromycin. Despite aggressive therapy, mortality remains extremely high, approaching 100%. Third, Sapenia diploidea, an amoeba that causes subacute encephalitis. Trophozoites gain access to the bloodstream or nasal mucosa, subsequently migrating to the CNS. It manifests as a solitary tumor-like cerebral mass, often presenting with focal neurological deficits, headache, visual disturbances, and seizures. Treatment is based on survival case reports and includes surgical excision of the mass, followed by combination antimicrobial therapy including azithromycin, pentamidine, itraconazole, and flucytosine.
These conditions highlight the need for early recognition through clinical suspicion and prevention via freshwater treatment and public health education. Beneath the surface of warm freshwater lurk free-living protozoa capable of causing devastating neurological disease.